Hi, my name is Ramesh Singha. I'm an interventional pain anesthesia trained physician, and I work at Republic Spine Pain out of the Spicewood Surgery Center in Austin, Texas. The TransLoc procedure is a relatively new system that I really like. It's one that has a few components I'm going to go over that I appreciate more than the old allograft system I used to use for the past few years. And one is because it's a screw system. And before I used to use allograft, which I would use a mallet to hammer into place into the joint to distract it and fixate it, which did have good outcomes. However, I was a bit concerned about what if I can't remove that. With TransLoc's screw system, I can remove it because it is a titanium screw, very solid. It's not going to crumble in the joint, and easily I can screw it in and screw it out, and if need be, redirect it into the joint as better approximated. In addition to safety, the TransLoc system has a lot of safety components over the traditional systems that make it superior. One is that it has a self-stopping component so that it cannot be driven further across the joint, unlike other systems which may be driven too far deep and may actually cause additional pain. It's also a system that is not self-driving, so we originally will use another tool or implement in order to make the channel, and this will follow that channel. It will not go off into the weeds and form other issues when we're not planning to go there. So that's another primary reason why I chose that. When a patient comes for a TransLoc sacroiliac joint fusion, oftentimes I tell them it will be pretty painless. You'll be walking the same day, you'll be going home within an hour, you may be using ice, you may need some pain medications, you may not. And that there have been patients who a week after having surgery have gone on vacation and walked around Scotland without any problem. So that's what I tell them. Essentially it's true. The incisions that are there are about an inch in diameter. If we make 1 inch incisions, if we make 2, it might be a centimeter each if we choose to go for each screw. Basically, it's going to be a very little downtime. The sutures get self-absorbed. There's no stapling, and again, walking within hours of the surgery, going home the same day. Definitely no inpatient state. Blood loss is probably about 5 cc's compared to the magnitude of 4 or 5 with other sacroiliac joint fusion procedures. And so the expectation is that the patients will do very well and maybe back at work the next week. Fortunately or unfortunately, there is no one type of sacroiliac joint patient. I've had patients who are in their 20s who come in and they describe mostly one-sided pain in their low back. We do a workup and it turns out to be sacroiliac joint dysfunction. It could be because they had congenital hip dysplasia. It could be they were playing lacrosse in sports and got hit. A number of things, but certainly we've had 20-year-old patients who've had to undergo sacroiliac joint fusions. Just last week we had a 40-year-old gentleman who had hip joint replacement due to underlying trauma, and he ended up having sacroiliac joint fusion just last week after undergoing numerous sacroiliac joint injections and then needing a little more permanent treatment. In addition, even older patients who've had maybe other arthritis in the sacroiliac joint until the point where it became unstable. Patients in their 80s. We had a patient who was 82, and we did her sacroiliac joint fusion because she had persistent pain even after getting a spinal cord stimulator for her radiculopathy or radicular pain, i.e. sciatic pain. And she had some pain remaining, which after we did an evaluation found to be sacroiliac joint pain. She celebrated her 82nd birthday. She was dancing with her family, and that was after sacroiliac joint fusion. So no age is limited to having this done.